Okay, chapter 4 is communicating with the health team. And before we get started, there's just a couple of things I want to tell you so when we get to that point in the chapter, you'll understand what I'm talking about. First of all, when you break down medical terms, you have to think about your elementary school English. All words are made up of elements. So you have the suffix, the prefix, and finally the root. When you break down medical terms, you always start with the suffix, go to the prefix, and finally the root. So this particular word, itis, means inflammation of. Endo relates to the lining of an organ. And anything that relates to card relates to the heart. So this word means inflammation of the lining of the heart. So when you break down medical terms, you always start with the suffix. The suffix ectomy means removal of. Tonsillectomy, removal of the tonsils. So when we get to that point, you'll understand what I'm talking about when I refer back to this. Okay, and then one other thing. If you're handwriting in a medical chart, which is kind of rare nowadays, but occasionally you'll be in a facility where you must write free-handed. If you make a mistake, you have to make sure that it's clear to everyone that that's a mistake, but it still has to be readable. So maybe you're charting Mr. Jones drank 180 cc's of orange juice for breakfast. Oh, wait a minute, that wasn't him. That was his roommate. So you made a mistake, you draw one line through it, write error, your initials, and the date. Then you write what you meant to write. Because if this appears in a court of law, it's clear you made a mistake, everybody does it, but it's readable. If you went back to your chart and said, oh, that wasn't him, I better mark this out, that's not readable. So suddenly, in the middle of the night, Mr. Jones drops dead from a heart attack. It's because you gave him grapefruit juice. Grapefruit juice counteracts almost every cardiac drug. And you cannot prove that you did not give him grapefruit juice because no one can read what's written. So always, if you make a mistake, leave it readable, but make it clear that it was a mistake. Okay, when you're charting. And we'll talk more about that in just a few minutes. All right. Health team members communicate with each other to give coordinated and effective care. You're going to share information about what's been done for a person, what needs to be done for the person, and what was their response to that treatment. Communication is the exchange of information. For good communication, you need to use words that mean the same thing to you as to the receiver of the message. So you can't talk to your patients in medical terms. They don't know what they mean. And always pay attention when you talk to people. If they appear to not be understanding, ask them, does that make sense to you? Because if you talk to a layperson in medical terms, you walk into the room and you say, the phlebotomist will be here soon to draw serum. We're going to do a CBC and a BMP to check you for a possible cholecystectomy. They're going to think, am I going to die? They're just going to do some blood work to see if you got a bad gallbladder. Okay? So speak to people in terms that they understand, because a lot of people won't tell you they don't understand. They feel like their intelligence will be questioned. Because if you're using those big words, they think you know what they mean. So always speak to people. If they seem like they don't understand, ask them. Did that make sense to you? Sometimes I forget and use those 50-cent words. Use familiar words, be brief and concise. Give information in a logical, orderly manner. Give facts and be specific. The medical record, also called a chart or clinical record, is a written or electronic account of a person's condition and their response to treatment and care. It is a permanent legal document. The information in the document belongs to the patient. The document itself belongs to the facility. The person has a right to see their information. Nursing centers have policies about medical records and who can see them. They address who records, and almost everybody on the nursing team has to record something. When to record, don't ever document something before it has been done. So you might be charting the intake of all your 10 patients. Oh, Mr. Jones always eats 100% of his meal. Well, it so happens Mr. Jones isn't eating 100% of his meal, and there's something very wrong with him. But because you've charted that, the nurse thinks he's okay. So don't ever chart something before it has been done. Abbreviations, you're already learning the abbreviations in the back of your book. Correcting errors, I showed you that. If you're using an electronic medical record, you can backspace and the word will go away and you can write what you meant to write. There's no eraser marks or markouts on that. Ink color is not such an issue anymore. Years ago, ink color designated the shift. Blue or black was used for 7 to 3, green was used for 3 to 11, and red was used for 11 to 7. The color indicated the shift because everyone used a 12-hour clock. So if the nurse told you the patient fell at 1, if you looked at the chart and it was written in blue, it happened at 1 in the afternoon. If it was written in red, it happened at 1 in the morning. But now, everyone writes in black and uses a 24-hour clock. 0100 is 1 a.m., 1300 is 1 p.m. So most facilities do use a 24-hour clock, but they'll give you time to learn that. They don't expect you to come in there already knowing it. But they don't really use those colors anymore because we live in such a litigious society that they found that the green and red don't photocopy to appear in court. So now everybody writes in black with the 24-hour clock. Signing entries, you always sign your title behind your name. Before you get your state registration, your title is NA. Once you become state registered, it's SRNA. But always put your title. Excuse me. Okay, you have an ethical and legal duty to keep the person's information confidential. Under OBRA, residents have a right to the information in their records. Forms that relate to your work include the admission sheet. You might need to look at the admission sheet to see things about the person, maybe their religion, their responsible party, their diagnoses, their code status. Progress notes, every department has progress notes, dietary, social services, doctor, therapy. Activities of daily living flow sheets. In your textbook, there's an example on page 54 of an activities of daily living flow sheet. In most facilities, it's on computer now. You have to open the computer and put the information in. But occasionally you'll find the handwritten ones, and this is an example. And if you'll notice, there's a look back. It has all the days of the month and how different ADLs are progressing. For example, on the very first one is bowel movement. On the first of the month, the person had a medium bowel movement. On the third of the month, they had a large bowel movement. It has to be documented so you can look back. In most facilities, they have bowel protocol. If someone doesn't have a bowel movement within 3 days, the nurse needs to find out why. You can die from a bowel obstruction. So it's very important that you monitor these things. Excuse me. Other flow sheets, you may have to document intake and output, vital signs, progression of a wound. There's so many different sheets that you might be asked to fill. The Cardex is a type of card file. There's an example on page 55, and it's pretty much like a care plan sheet for a nursing assistant. It summarizes information found in the medical record. Okay, resident care conferences. OBRA requires 2 types of resident care conferences. These are meetings when you invite all the departments together with the resident and their responsible party to discuss their plan of care. The Interdisciplinary Care Plan Conference is held a minimum of every 3 months. So the family can come in and you can tell them, this is what we're doing for your mom. Dietary, your mom's eating really, really well. As a matter of fact, she's gained a few pounds. Then the social services, well, she's been a little depressed lately. She's not been coming out of her room as much as possible. Is there something going on at home? And it gives everybody an opportunity to talk and see how things are going. The family might ask for a problem-focused conference, or if something comes up in the facility might ask for one. They have several days to put this together to make an appointment. The family might call and say, I've noticed my mom, every time I come over, she's not as clean as she usually is. I'd like to have a meeting to find out what's going on. So they'll have a few days to get all the departments together so everybody can get together and talk. The person has a right to take part in these conferences. Always invite the resident as well.
When initiating, like how you said, if a resident's not being taken care of, who do you go to say, oh, I want to have this meeting in place? Like, who would be the person you contact?
You can usually contact the charge nurse, but it's ultimately going to be the social services director. A lot of times they don't see the social services director on a daily basis, but they can tell the nurse, the charge nurse, and they can get with social services as well as the administrator or director of nurses to set up this meeting. Okay, reporting and recording. Reporting is the oral account of care and observations. Recording or charting is the written account. End of shift report. Information is shared about care that has been given, the care that must be given, the person's condition, and likely changes in their condition. So maybe if Taylor is relieving me and I'm getting ready to go off shift, we will do report. So I'm going to tell her, Mr. Smith in room 101 has had a really good day. He's just recovering from the flu. He's eating better. The nurse just asked that you keep an eye on him. If he still has his cough, she'll be happy to treat that. Mr. Jones in 101 bed 2, he has lab work in the morning, so he's NPO after midnight. That means he can't have anything to eat or drink after midnight. The lab should be here between 6 and 7. We've asked dietary to hold his tray. So don't forget to go get his tray for him after the lab comes to draw his blood. And we do that for all the patients for end of shift report, to let your oncoming staff know what to expect, what's going on. And if you don't think you've got a good report, go to your nurse. And they're probably going to have extra choice for you to do as well anyway. Recording, anyone who reads your charting should know what you saw, what you did, and what was the person's response. And the 24-hour clock, we mentioned that already. And 2400 is midnight, 1200. No, I got that backwards. No, I didn't. 1200 is noon, and 2400 is midnight. Okay. Next, medical terminology, prefixes, roots, and suffixes. Like I just explained, the prefix is before the root is the word element, the basic meaning of the word, and the suffix is after the root. Medical terms are formed by combining these elements. Prefixes first, roots second, and suffixes last. And a root can be combined with prefixes, roots, and suffixes. In your abbreviations in the back of your book, you will find the abdominal regions. The abdomen is divided into the following regions: right upper, right lower, left upper, left lower. Because if you go into a room and you ask your patient how you're feeling and he says, my stomach hurts, that could be anywhere from the sternum to the pubis, because people think this is their stomach. So if they say to you, it hurts right here, you would tell the nurse they have pain in their right upper quadrant. If it hurts right there, that probably is their actual stomach. So you need to tell the nurse right upper, right lower, left upper, left lower. And it's the patient's right and left, not you looking at them. Directional terms. The direction of the body part when a person is standing facing forward. Anterior is the front, posterior is the back. Distal is the part farthest from the point of attachment. Proximal is nearer to the point of attachment. Lateral is away from the middle. Medial is near the middle. And a lot of times you'll see these, especially if you maybe work on a orthopedic unit. Abbreviations, shortened form to words or phrases. Use only the abbreviations that are accepted by your center. They don't use all of them. Some centers have their very own abbreviations, but you will be taught those in your orientation. Computers, computer systems collect, send, record, and store information. They save time, they increase quality care and safety. Fewer errors are made in recording, records are more complete, and the staff is more efficient. A lot of times you'll get new EMR, electronic medical record systems. People are very reluctant for change. They don't want to have to go through that training, but most of the time, by the time they get through it, they see that it's a much better system.
In regards to like recording and such, will I need to know all of these different word elements, like have all of them memorized? Or?
No, whenever you get into your specialty, whatever you decide to do, if it's orthopedics, cardiology, geriatrics, you'll be familiarized with most of the terms that you'll need to know. Just be familiar. Just when you glance through your book, you'll see a lot of different ones, and they'll fall together. Phone communications. Good communication skills are needed when you answer the phone. Be professional and courteous. Practice good ethics and follow your center's policy. So, depending on where you are, some of the nursing homes, at the end of the day, when the office closes, the phone calls go through the nurses' stations. So you might be asked to answer the phone. Just always be professional and follow your center's policy. Dealing with conflict. If problems are not worked out, the following can happen. Unkind words or actions occur, the work setting becomes unpleasant, and then care becomes affected for your patients. To resolve conflicts, identify the real problem. This is part of problem solving. First, you need to define the problem. Collect information. The information must be about the problem. Identify solutions, select the best solution, carry it out, and then evaluate the results. Guidelines for managing conflict. Ask your supervisor for time to talk privately. If you have an issue at work that needs attention, you need to tell your supervisor. Don't let it become such a problem that you want to resign from your job. You need to address the problem. Approach the person with whom you have the conflict. Agree on a time and place to talk. Talk in a private setting. Explain the problem. Listen to the person. Identify ways to solve the problem. Set a date and time to review the matter. Thank the person for meeting with you. Carry out the solution and review the matter as scheduled. Don't ever, ever, ever stand in the hallway and argue. That's not appropriate, it is not professional, and it's frightening to the residents that live there. Quality of life. Health team members must communicate with each other for effective and coordinated care. False or incomplete information can harm the person. Resident information is personal and confidential. Always protect the right to privacy. And that also goes along with your intercom systems. If the patient turns on their call light and you use an intercom system, when you respond, you say, "How may I help you?" And they might ask you any number of questions. Maybe they just need fresh ice. Okay, I'll bring it to you. But if they ask you, "Is my lab work back?" you would not say, "Yes, your VDRL is positive. You do have syphilis." Don't say that over the intercom. You don't know who's in the room. So you want to remember confidentiality even on the intercom. In that case, you would say, "I'll send the nurse to talk to you."